Hello, so we're going to present you our product, which is implantable biocapsules for treating type 1 diabetes. The clinical need for this product is that 422 million people have been diagnosed with diabetes around the world, and 5% of this has been type 1 diabetes. So we chose type 1 diabetes because it needs a more complicated treatment than type 2 diabetes, which can be controlled with healthy diet and exercise. So currently, people need to constantly monitor their glucose level in the blood, and in case of high concentrations of glucose, need injections or pumps that would cause scarring tissue in case of injecting it in the same location several times, as we can see in this picture. Also, needles are hazardous for children and adults, and it requires a lot of skill and knowledge when administering it. Regarding the expenses, $245 billion have been used in the 2012 in the US to find a treatment for this condition, and people are seeking for a more accessible and economical way to treat this diabetes.
So the solution that we are proposing is to use a biocapsule containing the islet cells. So both sides of the biocapsule is going to be capped with a silicon nanopore membrane, which will allow the selective diffusion of smaller molecules like insulin and glucose, but prohibit the entry of larger bodies like immune cells and antibodies. And so what this does is it effectively immunoisolates the islet cells from the rest of the body, which means that the islet cells can perform their natural function without experiencing or inducing the immune response that's typically seen in type 1 diabetes. So this capsule is going to be implanted in the intraperitoneal cavity due to the fact that the region is highly vascular and the availability of an adequate amount of oxygen. In terms of fabrication, the material will be made by the etching of silicon wafers using MEMS technology, and the process is to create two separate cavities, and then once the islet cells have been encapsulated, to join the two cavities together using some sort of medical adhesive. And some surface modifications that we would like to include will prohibit protein fouling, promote cell adhesion, as well as provide anticoagulant properties. And so our suggestion is to regulate the surface using RGD peptides as well as heparin molecules.
So now we're going to discuss the benefits and the cost of this product. And regarding the benefits, patients would no longer need to monitor blood glucose levels, and this will eliminate the need for insulin pouch injections when glucose levels are high. Also, in the case of immunosuppressive drugs, it would no longer be needed for islet transplantation. And all of this is good because it would be an easier and simpler method for patients to improve their quality of life.
For costs, the biocapsule needs to be implanted, so that means that surgery is required and it's more invasive. It's also a novel technology, so patients might be less willing to try it, and because it's new, it could be expensive at first. And also a reliable supply of pancreatic islet cells are needed because they are taken from recently deceased donors. They're not really readily available. In terms of competition, lancing devices are most commonly used by most patients to monitor the blood glucose levels. Medication is also another option for decreasing glucose levels in the blood. Insulin injections and pumps are some of the most common treatments, but the injections cause pain and scarring tissue like we've discussed, and the pumps are external devices and they're not really user-friendly. The islet transplantations are most similar to what we're doing now, but they require a catheter to guide the cells through the abdomen to the liver, so it's not very comfortable for patients. And finally, an artificial pancreas was recently approved by the FDA, and that involves a monitor for blood glucose as well as an insulin pump.